Now, Dr. Quinn, thank you as always for joining us. Tell us what are some general actions that our viewers can consider to prepare for a possible upcoming severe weather disruption?
Well, the best thing is to always be prepared, to have a plan, and that way you'll have a better chance of having the best outcome. Now, some general tips that you can do is prepare a water bag where if it rains in your home, then it won't destroy what you're going to prepare. And what I'm suggesting you prepare is a list of all your records. Inside of this bag, I have some things written down. You want a list of all your medications, a copy of your driver's license, some type of identification, and a copy of your insurance cards, all within this bag. You also want to have a list of your clinics that you go to. If you go to a cardiologist, a general doctor, a pulmonologist, you want to have all this within this bag. You also want to have a list of any type of clinics that you've been to in the past. Just anything that can help you if you get into a medical situation after a storm that comes up, where you lose power, maybe your house, a tree falls into your home and there's a lot of water in your home. If you have that prepared list, water resistant, then you'll be prepared. And that can help get that information that you need to any type of medical treatment that you receive after the storm.
All right. So, what should viewers that take medications that has to be essentially maintained at a certain temperature, what should they consider?
Right. So I talked to one of my pharmacy colleagues earlier today, and he advised that they can come to the pharmacy and talk to the pharmacist about the temperatures of the medications. Any medications that have to be at a certain cooling level, maybe they have to be in a refrigerator, he can sort of talk to them about buying a cooler that they'll have in their home already set aside, and they'll know about how much ice to put in there, and they'll have it written down. So in the event of a storm where they lose the power for a week in their home, they already know what to do, and they could go purchase the ice before the storm.
All right. Thank you for that. Well, last question, suggestions for patients that cannot get access to their personal medical providers.
Right. Now, another thing you can do is you can contact the hospital where your medical provider is associated and find out about other associated clinics with that hospital. The good news about that is they'll probably have access to the medical records of your primary care doctor. Also, in your local area, find out if there are clinics that accept patients as walk-ins, and you can go ahead and get established there in case you can't get in with your primary care doctor.
All right, that was Dr. Quinn for you. Thank you so much, Dr. Quinn. As always, here's Gracie with an update on Francine.
All right, Sal. Yes.